The following segment is sponsored by Oakview-Medical-Associates and Body-by-Bijoor.
To awaken your weight loss potential, you have to establish good, healthy lifestyle habits. Dr. Nita Bijoor from Oakview Medical Associates and Body-by-Bijoor is here. Good morning, Dr. Nita.
Good morning. How are you?
Great. Good to see you. First, why is a healthier lifestyle so essential during these pandemic times?
Yes. So right now, as we've all seen, a lot of the patients who've had chronic diseases like high blood pressure, diabetes, obesity, high cholesterol, these are the patients or people that were at especially a higher risk for infections and death. So now more than ever, I think we should take that knowledge and realize that we have the power within us to make certain changes in our lifestyle to improve and reverse chronic disease. Also, most of us have more time, the flexibility, either working from home, schools are out, kids are home. So there's a lot more connection between our family and friends in a different way, although we have social distancing, that we can really take advantage of. And we have Zoom, we have all these other lovely methods to stay connected. So I think we can be held accountable, and it's a great time to do that.
Absolutely. And when it comes to establishing those healthy lifestyle habits that can help you lose weight, you like to use a mnemonic device, SMART. So let's start with S is to be specific. What do we need to be specific about?
So, for example, in weight loss, because I have a very large weight loss practice, and the goal of the weight loss practice is to then eventually make you really very healthy, get you off medications if possible. So S is being very specific for weight loss. Say, for example, we want to start a walking program. So being specific, I would like to walk during the week to help achieve, whatever pounds of weight loss. And we do it in a very methodical, scientific way where we measure how much a person needs to lose in terms of pounds. So just being specific, the why behind why you need to do it, that's the S.
All right, so you define that. And now the letter M is for measurable, because we have to make sure the goal is measurable. How important is that?
So measurable is actually very important because it gives you a defined amount. You're like, oh, I can't get it in today. Can I just do it tomorrow? But if you say, my goal would be to walk 30 minutes at a time, at least once a day, then you've measured it. So when you've done your 30 minutes, you're done. You don't have to, if you make it longer or you don't have that number, then you may not even do it. So it's really important to have that measurable number.
That makes sense. And A is attainable. This has to be a goal that you can actually reach, right?
Yeah, with your lifestyle. If you're working long hours, 12-hour shifts, a night shift, it has to be something that's achievable, attainable within your lifestyle, within your framework, within how busy you are. So if you say, 30 minutes, is that attainable? Yes, for most people, walking 30 minutes is doable. So keeping it, achievable.
Determine something that is attainable. R is for relevant in this mnemonic device. What needs to be relevant?
So the change that is needed of you, that behavior needs to be very realistic and relevant to your condition. Don't go out there comparing yourself to someone else that's lost weight and some far out thing that they've used to lose the weight. This is in your situation, your lifestyle, your habits, your family, your work, your environment. So that's where we really help patients define what it is for them. And then those are the building blocks that get you to where you need to be.
Perfect. And finally, T is for time-oriented. We have to set an actual timetable to stay accountable. We just can't say whenever we get around to it.
Yeah, because, even our body actually works on several, we call it the diurnal variation. There's a chronological difference in hormones in the morning, in the evening. Likewise, we sleep when it's darker. So everything we check our A1Cs every 3 months. We prefer blood pressure follow-up visits every 3 months. There's a definite time-bound element to this because that's the way we achieve results. If we don't have a defined time. So for example, in walking, if we say, I would like to start walking 30 minutes at a moderate pace. What is that for you? 5 days a week for 3 months. Then, we've set a goal, and I will then discuss that again and again and again till we have measurable results from that behavior.
Yep, a goal is much harder to cheat when it's laid out that way and you know exactly what's expected. You help people establish healthy habits through your lifestyle medicine program, Body-by-Bijoor. Tell us about that.
if one wants to lose weight, or one wants to have more energy, if you want to have better sleep, better relationships, be calm, be happy, then we really have the complete mix. The lifestyle program incorporates everything from mental health, well-being, nutrition, fitness, personal training, better sleep, getting rid of bad habits. So that's what we call lifestyle medicine. It's very evidence-based. It's not just, here, take some herbs and supplements. We do incorporate a lot of tools that are very achievable, attainable, and in a very time-bound approach. So our program ranges from 6 months to a year, and we really help that individual achieve whatever they must achieve. That's called body-by-bijoor. Body is the mind-body connection. And eventually my goal is to really help the patient realize the power of the infinite, which is the mind, over the body or the physical self, which is the root cause of all our chronic diseases. If we know how to eat better, how to have better mood, better relationships, then we can actually improve our disease.
Absolutely. And your whole practice is really geared toward lifestyle medicine too. Tell us about Oakview Medical Associates and what makes it special.
So Oakview Medical Associates is a primary care practice. We see all ages. We see people for urgent care visits, sick visits, walk-ins. And then we also, if they have a chronic disease, we look at that from the causative standpoint and have a good plan for the patient and for me to have together to reverse the disease or treat the disease, minimize medications, keep you more healthy, keep you more energized, more proactive and more positive. We all are going to face health consequences, whether we like it or not, but how do we approach that and how do we manage it in a very positive, enlightened manner? That's our goal.
And you're passionate about guiding people through it. Oakview Medical Associates is located at 11 Five Forks Plaza Court in Simpsonville. The number 627-0444. Anything else we should touch on before we let you go? Anything else on your mind that people might want to think about?
At this point in time, with everything going on, I think the number one message I would really, and I might have said this before, is to calm down, be very present, be mindful, have an abundant mentality and approach. We all love one another. We all have the health. Don't look at it like a scarcity mentality. That doesn't get us anywhere. I think we need to all embrace everything that's good in our lives and be happy, have gratitude for everything. And I certainly value you a lot, Margaret. You do a lot for the whole community.
Oh, thank you, Dr. Nita. We all love you, and it's always so great to check in with you. We'll do it again really soon, okay?
Take care. Bye-bye.